Hello, my name is Kelly Knapp. I'm presenting our employee health patient scenario stage 1. As previously discussed, our patient suffered a back injury, and so patients reported it to her manager, and the manager requested that she go to employee health. So employee health sent the patient to the emergency room to have some tests done. The tests that they did an MRI, which is for soft tissue injury. They did an x-ray to see if there's any bone damage, and they did some blood tests to see if anything was elevated, white blood cells are elevated for the inflammatory response. So our patient was diagnosed, she had a herniated disc, and she was admitted to a medical surgical floor for treatment and observation. So for my critical thinking questions, what's the difference between an MRI and an x-ray? And why would both tests be ordered? What types of blood tests would be ordered and for what purpose? Question number 3 is, what treatments would be ordered upon admission to the hospital? And why would those tests be ordered? And then 4, how long do you think the patient would be expected to stay on a medical surgical floor? You can post your answers onto our video site. So this scenario number 2 is our patient, of course, was admitted from the emergency department to a medical surgical floor, and the staff was preparing to set up the room. The patient arrives to the room, gets the initial assessment. The patient rates her pain at 8 out of 10 on a 0 to 10 pain rating scale. This pain is considered high, so the nurse had to let the physician know that the patient needs medication that's appropriate for this type of pain. The patient states she's having weakness when she's ambulating, she feels a little dizzy, so our patient's placed on fall precautions because we don't want our patient to fall and cause more injuries while she's hospitalized. The patient's blood pressure was normal. The patient's temperature was a little elevated, which could be an indication of inflammation, and the patient was slightly diaphoretic, so she was a little sweaty. The RN finishes the assessment, notifies the physician of the patient's condition, the blood pressure, the fact that she's feeling weak and dizzy, put her on fall precautions, and goes to set about her care plan. Questions for critical questions number 2. Based on the patient's assessments, what medications do you anticipate the doctor to order, and why would these medications be ordered? Question 2. Based on the statement of weakness, what, if any, precautions should the patient be placed on? Question number 3. How frequently should the patient be evaluated for pain relief and temperature reductions? And why would they do it for this particular time? Question number 4. What are the orders you anticipate the doctor to write? And why would they write those orders? You can place the answers to these questions on our website underneath our blog. Okay. Patient scenario number 3 will be conducted by Maya. Thank you.